Good morning. I am Dr. R.KRISHNAN, Assistant Professor, PG and Research Department of Microbiology, St. Joseph College of Arts and Science, Autonomous Cuddalore. Today I am going to present the topic on anaerobic culture method. So the bacterial classification is based on the oxygen requirement. So there are four major type of classification. So one is obligate aerobe. They require oxygen for their growth, and they utilize oxygen act as an electron acceptor. Example for this type of microbe is Pseudomonas aeruginosa. Second is obligate anaerobe. They will grow only in complete absence of oxygen because oxygen is toxic to this bacteria. An example, Clostridium tetani. And third is facultative anaerobe. They can grow under aerobic as well as anaerobic condition. Example, E. coli. And fourth type is microaerophilic. They will grow best at low oxygen tension. An example, Helicobacter pylori. So when to suspect anaerobic infection means, if the person having a foul smelling discharges or necrotic gangrenous tissue and abscess formation and free gas in tissues, and also black discolorization of exudates, sulfur granules in discharges, and finally the bacteremia or endocarditis with no growth on aerobic blood cultures. What are the risk factors for anaerobic infection? So one is poor blood supply and tissue necrosis. Second is diabetes mellitus. Then third is splenectomy and immunocompromised patients. The sites with normal anaerobic flora in our body is mouth, throat, vagina, cervix, skin fold, intestine. So when you sampling these sites, not suitable for anaerobic culture but can cause anaerobic infection in nearby tissue after trauma, that is surgery. The sample specimens for anaerobic culture, which includes blood, abscesses, exudates, body fluids, deep wounds, sterile surgical samples, dead tissues, transtracheal aspirates, endometrial swabs. The unsuitable sample for diagnosis, the specimen from sites in which anaerobic bacteria or normal flora, for example, throat, rectal swabs, urine, bronchial washes, cervicovaginal mucosal swabs, sputum, saliva, and voided and catheterized urine sample. Then third is gastric content, small bowel content, fecal sample, cutaneous fistula and colostomy content should not be cultured for anaerobic bacteria. And specimens not submitted in anaerobic transfer media. Improperly labeled specimens should not be submitted. Follow the rejection of policy for unacceptable specimens. The sampling for anaerobic culture. One is aspirates the specimen using needle and syringe is the best and convenient way for sampling, following the procedure and remove the air from syringe immediately. If no pus or fluid comes on aspiration, inject sterile saline subcutaneously and resample. The last and least way is to use deep swabs and rapidly to transfer to anaerobic transfer media. The anaerobic specimen should be transported immediately. It must be done immediately to the lab within 1 hour or less than 2 hours. Never refrigerate sample for anaerobic culture. If delay can not be avoided, use the anaerobic transport kit, especially for swabs and small volume samples. And this is the image which shows the transportation of specimen into the laboratory. Anaerobic transport kits. And caution during sampling. Avoid shock to the anaerobic bacteria by exposing to oxygen or dryness of sample. Avoid exposure to cold, as well as anaerobic microorganisms are sensitive to cold. Avoid swabs in sampling, as swabs fibers contain ambient air and introduce oxygen to the sample. Anaerobic culture methods. So we have 4 important methods will be there. So one is use of media containing reducing substances. Example, Robertson cooked meat broth and thioglycol broth. Second is culture away from oxygen by using deep agar tubes. And third is chemical exclusion of oxygen. And fourth is mechanical exclusion of oxygen. That is by using anaerobic incubator. Number 1. The use of media containing reducing substances. Example for that media, Robertson cooked meat broth. Here the composition will be there, and it is only used for anaerobic cultivation, and it is sterilized by using a normal method, 121 degrees Celsius for 30 minutes. And this is the image of anaerobic culture meat broth. And second is thioglycolate broth. It is also anaerobic medium which is having more amount of hemine and vitamin K. It is also sterilized by using autoclaving. And this is the image of thioglycol broth. And next method is deep agar tubes. The simple way to produce anaerobic condition. The agar surface can be overlaid with oil to maintain aerobic condition. The samples are inoculated by deep stabbing. And this is the method for anaerobic cultivation using deep agar methods. Next is chemical explosion of oxygen. Here we are using anaerobic gas pack system. And this is anaerobic jar which containing the culture plates for incubation, and also the surface of this tank containing the gas pack. The final method is mechanical exclusion of oxygen. This can be done by using anaerobic incubator. Thank you.